Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place. Today's video is about obesity and chiropractic. So what I did is I took two different countries with different obesity rates, different lifestyles, so we can kind of review what's going on here in the US. We have currently an obesity rate of 36.2%, so over 1 out of every 3 Americans are obese. That's a significant number because we know obesity contributes to high risks down the road for strokes, heart attacks, diabetes, cancers, you name it. Your risk for all of that goes up. So it's important for us to discuss this since this has been on the rise for a while, and it's something that can affect even your chiropractic care. So in the US, we tend to have a lot of fast food options. There are something like, I think, over 13,000 McDonald's in the US. And in Vietnam, I think there's only like 16 or 17 in the entire country. There are lots and lots of ads for us to eat. And even certain times a day, late at night, you'll see these fourth meal and all this other ads to get you to go eat some fast food, when that stuff is not really going to nourish our bodies. In Vietnam, if you're there, they are at a 2.1% obesity rate. That is the lowest obesity rate, I think, in the world at this point. They have a lot of whole food options, fresh foods, fresh dishes that are available to people for your options. We tend to be a little bit more sedentary in the United States, and they tend to move a lot more in Vietnam. There's a lot more walking involved in day-to-day life, and that's a really cool thing for people to think about. I've been tracking my steps recently, making sure I do over 10,000 steps, and I had to realize, like, I'm not walking as much as I thought I was. I thought, oh, no problem, I'm easily breaking 10,000, and it turns out I wasn't. So I started incorporating a little half an hour walk after I eat my lunch during my day. I've been walking in the morning with my wife, Shelly, and we've actually been walking in the evenings as well. And I've been more than exceeding the 10,000 steps. And I have to say, I feel really, really good. So this is something for us all to consider, even Dr. Aaron, to consider, hey, I need to be tracking this and seeing if I can improve that. And it's really great for walking is that it's not super hard on your body. There's not a ton of wear and tear involved. And it is a foundational thing that you want to be able to move as you get older. So something just to keep an eye on there. Other thing here in the US, big portions are kind of becoming the normal everywhere we go. There's a lot more portion control, smaller portions for people. Even if you eat more frequently, but just had smaller portions, that's another way to look at doing this. So you can see there are some pretty big differences, and the numbers don't lie here. If we are eating more whole foods, we were just moving around more. I don't need you to do crazy exercises, but if we're just moving more throughout the day and keeping an eye on the portions we're eating, that can make a big difference if you're struggling with weight loss or anything like that. And this does affect your spine. The heavier you are, the more wear and tear on your joints, the more likely you are to developing arthritis in the knees, the back, the hips, you name it, because those are all weight-bearing structures, and the heavier you are, the more it wears those joints out. A couple of tips for me that I like to do. This helps me stay on track. None of us are perfect, not even me. A lot of us struggle if there's good foods around about making the healthy choices. So one of the things that I do that helps keep me successful at eating as healthy as possible, keep healthy food around. Make sure you stock up. We go to Costco every week, buy a lot of organic vegetables and fruits, healthy organic lean meats, and just try to have that stuff around. I'll even cook meat in bulk so that I have like chicken breast ready to go for 3 or 4 days at a time. That just helps me. I'm okay eating leftovers, and that keeps me on point. If I'm hungry, I know I can reach for something healthy. And then also making sure you're getting enough water. Sometimes people will eat more food if they are dehydrated because there is water, there's moisture in food. So another thing just to keep an eye on, if you're not drinking enough water, consider upping your water intake. So hopefully this video helps you guys understand obesity a little bit better. I'm Dr. Aaron Seaton with the Chiropractic Place.